Students, you're welcome to the next class. So I said we are going to be talking about diabetic ketoacidosis. Let's go. Diabetic ketoacidosis, also known as DKA, is a serious complication of diabetes that can be life-threatening. DKA is most common among people with type 1 diabetes. People with type 2 diabetes can also develop DKA. DKA develops when your body doesn't have enough insulin to allow blood sugar into your cells for use as energy. Instead, your liver breaks down fat for fuel, a process that produces acids called ketones. So instead of glucose to be allowed into the cells, now the glucose can no longer be allowed for some reasons. Instead, the liver will now start doing what? Breaking down fats. That breakdown of fat is supposed to be a temporary stuff. So that for example, if somebody is starving, for some reasons, things like that can happen, but it's supposed to be for a temporary purpose. But in these people, it continues, it lingers. So the body starts breaking down fats. It starts breaking them down to use it as fuel. Now, when too many ketones are produced too fast, they can build up to dangerous levels in your body. Now, what are the signs and symptoms of diabetic ketoacidosis? The DKA usually develops slowly. It takes time. Early symptoms may include being very tasty. Every time the person is tasty, urinating a lot more than usual. Because we know that frequent urination is one of the complications or problem of diabetes. If untreated, more severe symptoms can appear quickly, such as fast or deep breathing, fast or deep breathing, dry skin and mouth. The mouth becomes dry, and that will, of course, make them to want more water. Then flushed face, fruity smelling breath. Their breath is always smelling fruity, as if the person ate fruits. Headache, muscle stiffness or aches, being very tired for no reason. The person did not do any serious thing, and yet the person is always tired. Nausea and vomiting, stomach pain. Sometimes DKA is the first sign of diabetes in people who haven't yet been diagnosed. Yes, there are some people who are not diagnosed yet. So one of the things that develops, before they will know, is this DKA, diabetic ketoacidosis. See somebody always very weak, is weak. Even if they eat a bowl of fufu now, they are still weak. It's not making any difference. Now, what are the causes of DKA? Very high blood sugar and low insulin levels lead to DKA. High blood sugar level will be high. Yes, the person is not having enough energy, and yet the body will go and start breaking down. Insulin cannot do its work, and the body will start breaking down fat to use as fuel. Now, very high blood sugar and low insulin levels lead to DKA. The two most common causes are: one, illness. When you get sick, you may not be able to eat or drink as much as usual, which can make blood sugar levels hard to manage. Two, missing insulin shots, a clogged insulin pump, or the wrong insulin dose. Other causes of DKA include, we said it's more common with type 1 diabetes, the one that is insulin dependent. Okay, so when the person is missing the intake of that insulin, or there's a clogged insulin pump or wrong insulin dose, it can cause DKA. Other causes of DKA include heart attack or stroke, physical injury such as from a car accident. 3, alcohol or drug use. Then 4, certain medicines such as some diuretics, water pills. There are some drugs like corticosteroids which are used to treat inflammation in the body. So note, people with DKA, they test positive to ketone. So when you carry out urinalysis test on them, or of this dipstick, they will be ketone positive. So we have what we call hyperosmolar non-ketotic coma. Let's quickly look at it. Hyperosmolar non-ketotic diabetic coma, capital letter HHNC, is a syndrome of acute decompensation of diabetes mellitus, occurring mainly in the elderly and characterized by marked hyperglycemia, hyperosmolarity, which is high concentration of salts, severe dehydration, occasional neurological signs, obtunded sensorium, and absence of ketonemia or ketoacidosis, the mortality is high. So in these people, you don't see ketones, but yet the person is really diabetic. That's hyperosmolar non-ketotic diabetic coma. Non-ketotic hyperosmolar coma is a life-threatening metabolic derangement that can develop in people with diabetes mellitus, usually due to illness, infection, or failure to monitor blood glucose level. So that's why when somebody is diabetic, the person should be monitoring his or her blood glucose level. Now, the onset of this type of coma can be gradual and difficult to recognize and treat. The condition is more common among people with type 2 diabetes, rather than type 1 diabetes, and in older rather than younger individuals. So quickly look at the pathophysiology. Okay. Under pathophysiology, we have that a relative deficiency in insulin levels caused by mismanagement of diabetes causes a rise in blood sugar levels. Now, this triggers the kidneys to remove some of the glucose through urination. So when you do urinalysis for them, you see glucose present, causing dehydration and more concentrated or hyperosmolar blood. This concentrated blood begins to draw water from other organs, such as the brain or the kidneys. How is this hyperosmolar non-ketotic diabetic coma, how is it being diagnosed? Diagnosis is made through clinical examination of patient symptoms and history of complications and risk factors. Blood sugar levels usually need to be above 600 milligram per dl. That is for the hyperosmolar non-ketotic diabetic coma. So the blood sugar levels usually they need to be above 600 milligram per dl, and serum osmolarity above 320 milliosmol for a diagnosis to be made. So that is how the diagnosis is made for the hyperosmolar non-ketotic diabetic coma. So in our next class, we'll be looking at lactic acidosis. See you in my next class. Bye.